One of the issues that I think is top of mind and certainly top of our list that we need to be able to handle appropriately and successfully is the documentation. We are moving from a paper world into an electronic world. Right now at the University of Utah, we have 2 EMRs. We have Cerner, which captures most of our inpatient and some of our outpatient records, and we have Epic for our clinic information, our specialties, and our community clinics. We're moving to bring those things together, but as I've worked with both of those systems, I began to realize that there's more needed. The information that those systems contain are designed as EMRs are designed, where you go in and you use drop-down lists and you do discrete data entry. That's very important, and it serves a real purpose in the organization to support research, reporting, and a number of things that allow you to mine the data and get that information back out. But ultimately, the record needs to reflect the care that the patient has had. And one of the things that we are discovering is that the discrete data approach sort of goes to the lowest common denominator. You can get information about the patient, but it doesn't feel very personalized. And as you read that information, sometimes it's hard to tell that one patient from another as you're reading that information. You don't feel like we used to in the paper record when we had dictated documents or handwritten progress notes, for instance, that you really understood what was going on with the patient. So we're very committed to using technology like the front end and back end speech recognition, full dictation and partial dictation appropriately together to create a richness in the record that allows us to be able to provide warmth and that sense of really knowing that patient, really beginning to understand what's going on with them, because without that information, we're left with something that feels very much more mechanical than we want to have. So we are working closely right now with Nuance to help us move in that direction. We have some of our groups are already using eScription, which gives us the back-end speech recognition. We're using Dragon technology to help us on the front end in many cases, like our emergency department, radiology, where we can capture information that gives more detail about the patient than a typical EMR does. But we're also looking to roll it out in many other ways in the organization so that we can build that warmth and richness back into the record that we've been missing for those clinics, for instance, the community clinics who have had no dictation for the past 10 or 11 years, and their records feel very sterile. We believe that's best for the providers who provide follow-up care to have more information about the patient so that they can really understand what was going on in that patient's care prior to them taking over the care, and then also for the patient for both quality of care and patient safety issues to make sure that as they move along that continuum of care, they get the information that they need.